Hello, this is Dr. Steve Horwitz with Capital Sports Injury Center, and today we're going to talk about thoracic spine mobility. The thoracic spine, or the mid-back, is the area between the neck and the lower back. We're going to talk about 9 different thoracic spine mobility exercises. First one we're going to talk about is the foam roller. And what I've done here is I've put a model spine on a foam roller. So you can see that the thoracic spine is on the foam roller, and what we want to accomplish when we use the foam roller is mobilization, or getting more movement in each joint area. And if you look at the spine, you'll see vertebra, meaning bone, disc, then vertebra, then disc, then vertebra. So we have all these areas where movement takes place, and that's in between a vertebra, disc, and a vertebra. So what we want to do when we use the foam roller is get movement from each segment one at a time. So instead of the model spine, now you see me on the foam roller. I'm bridging my buttocks up just a little bit, and what I'm going to do is arch very gently and slowly over one motion segment. Remember, that's vertebra, disc, vertebra at a time. I'm going to take a breath in on the way up, out on the way down. I'm just going to go gently 3 or 4 or 5 times each area. Very slowly. Again, I'm going to be breathing while I do this exercise. I'm going to work my way all the way down the middle back. On some videos you see people doing this type of thing. That's too vigorous. You can hurt yourself. Just nice and easy. Then when you're done, you can slowly roll back and forth across the spine, and then work your way down by walking your feet out and moving back and forth. Now the next exercise, I'm sideline. There's a ball underneath my knee. I'm going to maintain pressure down to the floor with my knee. Have a little support for my head. I'm going to grab around my ribs. Again, focusing on the breathing. Take a deep breath in, and on the way out, roll back. So I'm trying to take, in this case, my left shoulder blade, trying to touch the ground behind me while I'm putting pressure against the ball. So breath in, and then out. And you can hold the stretch the length of your exhalation. On this exercise, I'm going to keep my knee against the ball. In this case, I'm going to keep my right arm lifting up to the ceiling, knee pressure on the ball. I'm going to rotate my other arm down to the floor, come back up, down to the floor, come back up, breathing out, down to the floor while I'm reaching this arm up. Go. On this exercise, I'm sideline. My knees are just above 90 degrees, knees together, both knees pushing down into the floor. My bottom arm is pushing down into the ground. I'm going to start with my hands together, and I'm going to rotate. In this case, I want to maintain a line from my hands right down through my shoulder and my collarbones. I'm trying to take that back shoulder blade and touch the floor. As I'm reaching back to the floor, my knees are pushing together, and this top hip is pushing forward. I don't want to let my hips go up like that. So as I rotate, breath in, and then out. Knees together, top hip forward. I'm rotating back. And I can do the same thing. Instead of my knees together, I can put one foot up on the ball and do exactly the same maneuver. Here, this is pushing against the ball. This one is a little bit easier as I rotate back. And I want to make sure I make a straight line from my arm through my collarbones. I do not want to bring my arm back like this, which puts unnecessary pressure on the shoulder. Now this one, I'm butt to heel. One arm is down in between the knees. This arm behind the head. And I'm going to lift my elbow up and try to rotate my torso and not let my hips move. So I'm going to lift the elbow up, breathing out, rotate my torso, lifting the elbow up, not letting my hips slide. If your hips start to slide, what you can do is widen your knees, do the same position, and rotate this way. Your hips won't slide. This way is a little bit easier in the beginning. However, the other way incorporates your core to stabilize. So once again, I'm down, hand on the back of the head, lift the elbow up, and I'm rotating, looking up to the ceiling, not letting the hips sway out to the side.
Go.
Now this one, I can put my hands behind my head, take a breath in, breathe out, I can rotate, and I'm going to lean to the side. Breathe out. Come back, keep my rotated position, rotate a touch more, lean to the side. I want to make sure I have a long neck, meaning I don't want to bring my head back. Go the other way, breath in, breath out, rotate and lean. Maintain the rotation, come back up, rotate a little more, and lean. And come back. On this one, my elbows are up on the bench. I'm kneeling on a pad. Place my hands behind my head, starting, and then go down and come back up. I'm sitting back with my buttocks, coming down, back up, coming down, and back up.